Dr. Corey Maas on Looking Your Best, and today I wanted to take a few moments to talk a little bit about skin lesions or skin bumps and new growths and things that we see on our skin that are unusual or things that might bother us. And there's really a couple of categories that I could define of skin lesions based on that. There are skin lesions I think that patients more or less find annoying or unsightly. And some of those can be skin lesions that have a potential danger to them. And then we have skin lesions that have actual functional significance and or are threats to our well-being. As most people know, the skin is the largest and by far the heaviest organ in our body. It is our barrier or protection to the outside world and environment. And skin cells are constantly at the surface dividing and working their way to the surface, where they thin and thin and thin and ultimately become basically a shingle layer of dead skin cells that gently exfoliate from the surface. With all that cell division and with all the various components of the skin, hair follicles and pigment producing cells and some of the cells of inflammation that help to guard the skin as well as provide that protective area, there are a number of growths that we can see. Let me tell you just a few of the more common benign skin growths that people often ask me about. The first one is a seborrheic keratosis. And a seborrheic keratosis appears as a waxy sort of lesion on the skin surface. It's often got a kind of corrugated or rough surface to it. They can be clear or they can be slightly pigmented to brown. A lot of people mistake them for moles or nevi, but they're actually growths or overgrowths of the waxy glands of the skin, a condition we call hyperplasia. So pigmented or non-pigmented seborrheic keratoses we very commonly see both on the face and on the body, and I've literally treated patients that have thousands of them on their body. Obviously we don't have to get every one of them, but when they're bothersome because of their color or their position on the face, they're relatively easy to treat. As a general rule, when we have pigmented lesions anywhere on the body, it is probably safest to do what is called a shave biopsy, which I can describe in some detail. But with a shave biopsy, we're really not creating a scar. We're just taking a sample of the lesion itself. We're sending it to the pathologist, who's the doctor that looks at it under the microscope, making sure that it's not of any danger to the patient. And then once we're assured of that, now we've got it cleared, there's nothing to worry about. Most of these seborrheic keratosis with a shave biopsy, curettage where we're gently scraping, freezing, or even burning using thermal injury with anesthesia, of course, are effective ways of getting rid of these lesions. It's very important that we distinguish pigmented, if you will, or brown seborrheic keratoses from dangerous lesions like malignant melanoma or melanoma, which most people have heard about, which is always arises from pigmented cell, or most often arises from pigmented cells. There are rare kinds that are non-pigmented, and melanomas have certain characteristics that we want to rule out. Typically, and this is a good general rule for people to think about when they're looking at skin bumps or lesions on themselves. If something is growing or rapidly changing, if something is changing colors, or if the skin bump or lesion has irregular borders that are not very well defined, these are ones that we're a little more concerned about, and one that you should seek the advice of your physician, dermatologist, or a qualified facial or plastic surgeon to evaluate them. The other frequent types of skin lesions that we see that are benign in nature but have some potential are lesions that are called actinic keratosis. And actinic basically derives from sun, and keratosis is an overgrowth of skin, so they're basically sun-induced overgrowths of skin. Keratosis, again, is a diagnosis that we often hear when we're talking about skin lesions. Actinic keratosis are very common, especially in sun-exposed areas or people who have had a lot of sun damage. They typically start as a red and sometimes scaly lesion. People will often describe them as becoming ulcerated or like a little sore. They'll heal up, they'll go away, and then they'll come back again. And actinic keratoses are the types of lesions we definitely want to biopsy. Very commonly doing a shave biopsy or even an ablation of them will totally cure them. But if we see any sign that these might be changing into something more dangerous, we'd certainly want to follow that very closely. So red, scaly lesions, very commonly on the face and sun-exposed areas, sores that come or may go in some cases, or sometimes they just kind of flake all the time, are lesions that we want to evaluate, called actinic keratoses, which is very different than the seborrheic keratosis that we talked about, that typically has or can be brown or light in nature, and is sort of a growth that has a corrugated or irregular surface, almost warty in its nature. The last one, or last two that I want to mention that are important really are the types of things that we're most concerned about, and those are skin cancers. And anybody that has any concern about skin cancer, I would really encourage them to see their doctor, do a visit, have a skin inspection. There's very, very good mapping systems for this now. But skin cancers really, by far and away, are the most frequent cancer that human beings get. The most common type of them, which represents 80% or more of all skin cancers, is known as basal cell cancer. And basal cell cancers can actually start quite small and look quite innocuous as a little papule or bump that is sort of waxy or shiny on its surface. Some of them will have a little central umbilication, just like a little belly button in them. It's very tiny, but they do slowly grow, and others of these can actually appear as sores or ulcers on the face. They have irregular borders or feel like rough skin. Again, they can arise from actinic keratoses, which are considered to be precancerous. So again, anybody that has a concern about these types of things should see a physician. And a more advanced and aggressive type of skin cancer is squamous cell carcinoma. The characteristics of these look very similar, and actually can look quite similar to actinic keratoses, where they're red, scaly, and ulcerative. And again, when they're caught small on the face, we can typically treat them quite effectively and safely and make sure that there's no danger. Both the basal cell carcinoma in particular is one that is only, except in rare cases, regionally affected. It's not something that spreads through the lymph nodes or around the body, so it's relatively easy to treat, depending on its size, of course, which is why we want to catch them small, and location. And finally, the one I mentioned earlier, melanoma. This is a skin lesion that we see with not so much frequency. It's much rarer. But the classic description is a mole that has different coloration in it. Very commonly it's red, white, and blue as described in the literature. Melanomas can often have a halo of skin or lighter skin around them. They're very dark lesions. They look like moles, but those colors typically change. And the borders, rather than being round and regular, can be irregular, and those are, when there's not very clearly defined borders to a mole, I think it's really important that we have that evaluated. Again, we want to catch melanomas when they're quite small. Now, not every pigmented lesion is a melanoma. We still have the standard run-of-the-mill mole or nevi, and nevi can be pigmented or they can be non-pigmented. They can have hair growing from them or not have hair growing from them. But for the most part, I see these on the face as being annoyances to people, and the typical treatment in my hands, unless they're positioned very strategically, is, like along a line, would be for me to shave the nevus. Now, nevi go deep in the skin, so we're not curing it, but if we can make it flat and have a little less color on the face, it's much less noticeable. And in some cases, we might decide to excise or cut them out and repair them. Again, the beauty of shave biopsies is there's no scar. There's a period of wound healing, which typically lasts for a week or so. But all of these are definitely worth evaluating. And if you have a facial or any type of skin lesion that you're uncertain of or that you're unhappy about in its appearance, it would be totally appropriate to have that evaluated by a physician. As always, I'm happy to answer any questions. I can tell you that in terms of sending photographs of skin lesions and having me evaluate them as a part of our video, consultation service, that's quite difficult because they're taken out of context. But any questions you might have, feel free to write me at drmaas.com. You can certainly send a picture of yourself along with any video that you have describing your question, and if you would like to share it with somebody and we can disguise your identity, that would be great. But again, we're very happy to have you. Don't forget to like us at facebook.com/Maas Clinic. Visit our video blog at drmaas.com or our website at maasclinic.com. As always, nice to be with you. Dr. Corey Maas on Looking Your Best.